Good morning. Welcome to chapter 26, digestive system. Let's talk about the function of this system. Digestive system is used for ingestion, means putting food in your mouth. Digestion means breaking down. Propulsion means moving it forward. Secretion, absorption, and elimination, removing the waste from your body. Your digestive system is composed of a tube that starts from your mouth and goes all the way to the anus, and also some organs that attach to this tube. For instance, you have salivary gland attached to this tube, you have liver, you have pancreas. So we have a tube that starts from the mouth to the anus, and then some accessory organs. In this side of the picture you can see the tube. In this side of the picture you can see accessory organs. Let's start with the tube. This tube is composed of oral cavity, pharynx, esophagus, stomach, small intestine, large intestine, and finally anus. The accessory organs, however, is composed of parotid salivary gland, sublingual salivary gland, submandibular salivary gland, teeth and tongue, liver, gallbladder, and pancreas. Among these functions that I just mentioned is all clear except probably propulsion. What is propulsion? Propulsion is composed of two different types of movements. One is called peristalsis and the other is called segmentation. Let's take a look at this picture one more time. If you think that food is going to come to your pharynx and it's going to drop to your stomach, you're making a big mistake. You cannot assume that bolus of food is going to come to the upper part of esophagus and this is like a pipe, open tube, and the food is going to drop inside your stomach. You have to push it down. As I said, this is a collapsed tube. Do you remember this picture? This is esophagus. Look at the tube, how collapsed it is. Or I showed you this one before. Look at the esophagus behind trachea. It's pretty collapsed. In other words, if you want this food to come down, you have to push it down. You have to squeeze from the top and relax from the bottom so the food can come down. The same is true if you want to move this food along the length of your small intestine or large intestine. It needs to be pushed. This pushing forward is called peristalsis. Well, in this picture, it shows that tube is horizontal. You can think about when the tube also is vertical in the case of esophagus. You have to squeeze from this area and open up this area and to make sure food is going to move forward. What about segmentation? Now, think about it. If you move this food forward all the time, there's going to be less chance for this food to get mixed with the GI secretion, with the enzyme and juice that is released from the wall of the GI. As you know, your stomach, for instance, is going to create lots of acid and enzyme. Your pancreas is going to release a bunch of enzyme. And if the food is going to pass through the small intestine very quickly, how are you going to digest the food to the point that you can absorb them? You don't want this food to just move forward. Therefore, we're going to use something that's called segmentation. In the case of segmentation, you're going to contract in different part of your GI tract. As a result, your bolus turn in a bunch of pieces. And then if you now relax this one and squeeze this part, then you're mixing this segment with this segment and this segment with this segment. So as you can see, by squeezing and relaxing and squeezing again, you are mixing this food with the enzyme that's released from the GI system, and also you're going to buy some time to make sure digestion is going to happen completely. So we have peristalsis and we have segmentation. Peristalsis moves the food forward. Segmentation is going to move it back and forth. The first part of this tube is oral cavity. The oral cavity, of course, is composed of tongue and teeth, but also has salivary glands, cheeks, lips, and palate. Let's take a look at this picture. You saw this picture before. Here is the opening to the pharynx. Remember, the roof of your mouth is composed of hard palate, which is your maxillary bone, and then behind it is a soft palate. which is soft and muscular. The continuation of this soft palate is going to create uvula. You remember there are two arches next to uvula. The first arch is called glossopalatine arch. The second one is called pharyngeopalatine arch. Between these two, we have a palatine tonsil. Also, I want you to know that the tongue is attached to the floor of the mouth by an extension. It's called lingual frenulum. We have frenulum also here that attach your lips to your gum, and also we have here frenulum. This frenulum is called labial because it means lip. This is inferior labial, this is superior labial frenulum. I hope you remember that the opening of the oral cavity inside the pharynx is called fauces. So from here to here is called fauces. If you raise your tongue, if you look at the under tongue, you can see a few holes there. These holes are opening of salivary glands. For instance, as you can see in this picture, next to frenulum, you have a hole, and that hole is an opening for submandibular salivary gland. Next to it, there are many smaller holes for sublingual salivary gland. This picture shows the sagittal cut of the oral cavity. As you can see, you have your tongue, you have lingual tonsils, hard palate, you have soft palate, and of course the uvula. The uvula is responsible for closing nasopharynx. So when the food comes, the uvula will be pushed up, and as a result, food is not going to get to your nose. So the function of uvula is closing the nasopharynx. If you put your hand over your neck right now and you swallow, you can see your trachea is moving up. When the food comes to oropharynx, when you swallow, your trachea is going to move up, and the bolus of the food is going to push this epiglottis down, and as a result of these two movements, your epiglottis is going to close your larynx, and as a result, food has only one way to go, and that is going to laryngopharynx and going to esophagus. So two things happens. Uvula goes up to close nasopharynx. Your trachea is going to move up, your epiglottis is going to move down, and as a result, food has only one way to go, and that is through esophagus. The last thing I have to add here for this picture is the word vestibule. As you can see in this picture, vestibule is a space between your gum and your lips. We said your oral cavity is composed of cheeks and palate. Your cheeks is a lateral wall of your oral cavity and has a big muscle. It's called buccinator muscle. Gingiva or gum is responsible to covers the alveolar process where the teeth is going to sit in. The teeth is going to be inside pockets. It's called alveolar processes, and gingiva is going to cover those alveolar processes. Now let's move on and talk about saliva. We have three sets of salivary glands: parotid gland, sublingual gland, and submandibular gland. But before we talk about those glands, let's talk about the saliva itself. We create around 1 to 1.5 liter saliva per day. The pH of saliva is slightly acidic, and majority of saliva is water. 99.5% water. The rest is solutes. But what type of solutes do you find inside the saliva? Well, clearly would be some ions like sodium, potassium, chloride, and so on and so forth. But more importantly, I think you should understand, saliva has immunoglobulin A, antibody A. Antibody A, as part of saliva, is going to help us to prevent bacterial interactions inside the mouth. So in a sense, is protecting our body against possible infection. That's why you've seen many times animals, they lick their wounds because their saliva are composed of immunoglobulin, just like human. The next component of saliva is lysozyme. Lysozyme is an enzyme that is antibacterial, so that's another way of protection that we have in our saliva. Saliva, of course, is composed of mucin. Remember, when you add mucin to the water, it's going to create mucus for lubrication. But besides ions and antibodies and antibacterial, we have some enzymes. For instance, we have lingual lipase. Lipase is an enzyme that breaks down lipid. We also have amylase. Amylase is an enzyme that breaks down carbohydrate. So your saliva can start breaking down lipid or carbohydrate, and also can protect you against possible bacterial growth in your oral cavity. But what makes you to secrete saliva? The salivary secretion, if you remember from your nervous system, depends on parasympathetic and sympathetic. Parasympathetic is going to use cranial nerve number 9 and number 7 to secrete saliva in a way that cranial nerve 9 is going to go to parotid gland, cranial nerve 7 is going to go to submandibular and sublingual gland. Sympathetic also is going to increase the secretion of the saliva. When the sympathetic is stimulated, you're going to create more of the mucin secretion of the saliva. In other words, your saliva becomes very thick. So parasympathetic is going to make you to secrete more watery saliva. Sympathetic is going to make you to produce more thick saliva, lots of mucin. As a result, when you're under stress, you feel that your lips are sticking to each other. You feel your mouth is dry. It's not that you're not secreting saliva. You are secreting saliva, but you're secreting very thick and sticky saliva. As a result, your lips stick to each other. As a result, you feel your mouth is dry because the secretion has less water and more mucin. Let's look at the location of these glands. As you can see here, we have parotid gland, we have sublingual gland, and we have submandibular gland. Let's take a look and see where they're going to drain to. Do you see that your submandibular gland is going to send a duct, and duct is going to open close to the frenulum? Here we go. But look at the sublingual. Sublingual has so many tiny ducts that opens in the floor of your mouth. So for submandibular, you have only one duct that opens here and is wide open, and the rest of these tiny ducts that you see here next to it would be for sublingual. The duct of parotid gland opens to the upper jaw next to second molar. As you can see in this picture, the duct of parotid gland is going to run along the border of the masseter muscle, and then it's going to poke through the buccinator and opens inside the mouth. Parotid gland is the largest salivary gland that we have. Although it is the largest salivary gland, but only produces almost 1/4 of the total saliva that we have. 1/4 to 1/3. Submandibular salivary gland is going to create almost 2/3 of the saliva that we produce. And finally, sublingual salivary gland create only around 3 to 5% of the total saliva. Our salivary glands composed of two different distinct type of cells. They have mucus cells and they have serous cells. Mucus cells, of course, produce mucin. Serosal cells, however, produce very watery fluid. This watery fluid contain ions, lysosome, and amylase. So mucus cells produce mucin. Serous cells pretty much produce the rest of the items that we talked about. Means water, ions, lysozyme, enzymes. As you can see in this picture, in your salivary gland, you may have both type of cells. You have serous cells and you have mucus cells. However, the difference is how many percent of the cells is one form or the other. For instance, you can see parotid gland only produce serous secretion. But if you look at the submandibular and sublingual, you can see they have both mucus and serous secretion. That brings us to the discussion of the teeth. Let's take a look at the anatomy of a tooth. The part of the tooth is exposed is called crown, and part of the tooth that is inside the alveolar socket is called root. Between root and crown we have neck area. The bulk of your tooth is composed of a material called dentin, which is harder than bone. The exposed part of the dentin is covered by another structure is called enamel, and that is going to create basically the crown part of the tooth. The root is covered by another structure is called cementum and is attached to the wall of the alveolar socket by a bunch of ligaments are called periodontal ligaments. The center of the root is called pulp cavity and is filled by A form of connective tissue is called pulp. Blood vessels and nerve, they're going to get inside the root canal and reach the pulp cavity through the opening is called apical foramen. As we grow up, first we're going to create 20 deciduous teeth. Deciduous teeth erupt between age of 6 months to 30 months. And after that, these teeth will fall off and be replaced by permanent teeth, which is 32 of them. As you can see in this picture, these are deciduous teeth. Each quarter of your jaw has only 5 of them, including central incisor, lateral incisor, canine, and 2 molars. You don't need to memorize at which age they're going to erupt. However, as you look at the adult mouth, you can see the number of the teeth increased, and we have now 2 premolar and 1 third molar. That's why we're going to add 3 more teeth in each quarter, and as a result we have 12 extra teeth. As you can see in this picture, we have a system of numerical to name these teeth. It starts from the right upper jaw, is tooth number 1, and goes all the way to the left side, and then it starts from the left lower and goes all the way to the right lower. This table of your book explains different terminology that involves your oral cavity. I explained them already, so please review and memorize them. Let's stop this recording here. I'll come back with the new sets of recording for the rest of the GI system. Have a good day.